Okay. Okay, we're gonna call to order. I'd like to call the July 2025 Clark County Board of Health meeting to order. Shannon, please call the roll.
Dr. Moore,
Present.
Dr. Robinette,
Here.
Dr. DeGuzman, Ms. DeWitt,
Here.
Mr. Adamson,
Here.
Mr. Griffith.
Here.
Okay, so additions and adoptions of the agenda. Are there any additions or modifications to the agenda? Okay, hearing none, could I have a motion to adopt the agenda as presented?
So moved.
Second.
It's been moved and second. Is there any additional discussion? Hearing none, all those in favor signify by saying aye.
Aye.
All those opposed, same sign. Okay, motion carried. Moving to approval of the last meeting minutes from June 18th. Are there any additions or modification to the regular meeting minutes from June? Could I have a motion to adopt the minutes as presented?
So moved. Second.
It's been moved and second. Are there any additional discussion? Hearing none, all those in favor signify by saying aye.
Aye.
All those opposed, same sign. Okay, the motion carried. Okay. Public comments. So we're at the public comment period of the meeting. This time is for anyone from the public to give an update of 3 minutes for comments. However, if you are the subject of one of the agenda items, this is not the time for comments, and you can present at that time. And I think that's for Mr. Boland. Okay.
My turn?
No, not yet.
Not yet.
Okay. All right. Old business, Springfield landfill, Ms. Zibby.
Thank you. So since the last board meeting, if you remember last month, we had the Springfield landfill on to see how we wanted to proceed with their licensing. Since that time, we've had a meeting with the owner, his consultant, and the Ohio EPA. The owner and his consultant are continuing to work with us and provide us with updated information. Last week, they sent us a draft copy of the topographic map, which is in your packet. Since receiving the map, Chris and I had a technical meeting with the Ohio EPA. We have some concerns about their, we call it overfill, so where their fill is located. Some of it, is they know is there where it's piled up and they haven't graded it out, but others is the extent of his historical fill and things like that we're working with the EPA on. But at this time, we feel they're working with us. They're being very responsive. They've done more than what we've ever gotten from them the past few years. And so we are looking and working with the EPA on how to get the full packet that we require for the licensing period, and then put conditions on their license to address anything that's still missing. Chris, is there anything else you want to add?
No, I think our recommendation is to table it. We don't want to completely off our radar, but I don't think anything needs to be done at this time because they are continuing to work with us. And after that call with the Ohio EPA, I think there's a few more things we're going to ask them to investigate. It's probably going to involve a survey of that overfill if it's hitting some of the boundaries of the surrounding properties. So.
Okay. Could I have a motion to table the action on the license application requirements for the Springfield landfill until the next regular board meeting?
So moved.
Second.
It's been moved and second. Is there any additional discussion? Ms. Hackathorn?
Dr. Moore,
Yes.
Dr. Robinette,
Yes.
Ms. DeWitt,
Yes.
Mr. Adamson,
Yes.
Mr. Griffith.
Yes.
Okay. Motion is carried. Solid waste nuisance.
Thank you. So this is 9410 Milton Carlisle. Last month, you guys voted to declare this property a public health nuisance. Today, Chris and I, and as part of that resolution, they had 21 days to abate the nuisance. So Chris and I went out today to visit the property, get some updated photos, and observe if any progress has been made towards abating that nuisance. Chris has some updated pictures he'll pull up for you.
Most of you were here for last month. I can flip back and show you previous pictures, but I might as well be showing you the pictures we took today, to be very honest. These aren't in any particular order, but I will show you, flip through these. If you were not here last month, I think they were in the packet last month?
I don't know, I think you
No,
know.
I think we just showed them up.
Just I'm gonna show you a few pictures of the property. Again, probably very similar to what you saw last month. I don't think a lot's been done. I guess that's my short statement.
The biggest thing I noticed is the shed on the very far right-hand side. Keep going over.
This one?
Yep. There were bags of trash flowing out, or things flowing outside of it. That's the only thing that I could tell was really different.
Different, that's pretty more.
But in the grand scheme of things,
No, that's a drop in the bucket.
Yeah.
We'll get to that here. Let me flip to another. So the reason we took this picture is we had some credible reports and pictures of a fire on this property. And it would appear we have a burn pile here. It's pretty obvious, the burn pile. I think probably a second burn pile here. You can see the discoloration and some of the vegetation here. And if you really look on the computer screen, you can actually see some of the vegetation is pushed down where it probably wilted from the heat. So not sure what we burned, but that's pretty obvious. That's what that was. Just to give you a couple more views, again, very similar to what you saw last month. I mean, make you seasick, but I wanted to move it through this picture a little bit. One thing that I'm not sure if I hit the picture yet, that I want to point it out. This right here is a storage container, a shipping container. And one of the pictures I got actually was a view into it. We'll get to that in a moment. Again, I'll just zoom in just to show you what we're looking at here. Bridge.
Chris, did you notice an odor?
We couldn't get close enough.
Oh, okay.
This is very far back off the road and there's a gate. So these are drone pictures.
Well, I know there had been complaints, correct, from last time.
Yes. Looking for the picture that kind of has a view into that shipping container. Yeah, I've got a better one than that. 1 second. That's kind of showed you how far back off the road it is. Let me go backwards for a moment. It was striking to me because we hadn't had a picture from this angle to see inside that shipping container before now. But it's obvious I think this is probably about filling.
Oh, wow.
You can see it's very likely full and spilling out. We hadn't had that angle before today. So, I don't know. I know we've got a couple folks here that want to speak to this. No action is required by the board because you took action last month. They failed to obey the orders of the Board of Health, and so they were given the 21 days, and not enough improvement has been seen, not nearly enough improvement, so it'll be referred to the prosecutor's office at this point. So, unless there's any other questions, Dr. Moore, if you want to open it up to the folks that are here to speak for 3 minutes.
Yes.
My turn?
that's your
Yes,
turn.
now it's your turn. Okay.
Hello, everyone.
I just want to thank Emily,
Zibby.
Libby, and Chris, and Alex, who's not here, for coming out for the health department and doing a wonderful job. The other guy you had, Charlie, worthless. It's been going on for 6 or 7 years. I've complained about it. Other neighbors have complained about it. It's finally, I hope, hopefully getting cleaned up thanks to these wonderful people here. You guys have done it. Thank you very much. You've done a great job, a wonderful job. My thing of it is, as you see the pictures right here, this is the house of two lawyers that know better. One's a corporate lawyer and the other one, she doesn't even practice. This is two lawyers here that live here. They ought to know better than this. So I guess the thing of it is, my problem is too, and I'm going to try to make this short, is that there's several animals involved in this. There's dogs and kennels in the back that have never been cleaned. There's goats. I'm believing, is it okay if I come back here for a second? In these houses right here, goats. There's some dog kennels back in here with Great Pyrenees dogs in it. Several of them, they stay out there in the winter. They bark all night long. I know that the county has been contacted with barking dogs. And there's cats. I'm feeding about 50, maybe 60 of their cats. I told them before they needed to get their cats spayed, which they never did. They said, well, we spay them when we can catch them. I've gotten 8 of them spayed in the last year. I got 4 or 5 spayed the year before, 4 or 5 spayed the year before. I've been feeding them. It's been costing me about $700, $800, $900 a month to feed these animals. I've taken them to the vet. One had pyrometriosis. That was $327 to have her fixed. Another one has been peeing blood. That's cost me $900 and it's still doing it. So they're letting these animals roam. I just got money off of them a few weeks ago because they were letting their ducks roam around. I was on another property that I own out of state, and these ducks pooped all over the patio, pooped all over my front porch, had to pressure wash it, clean it off, then pooped down the brick in my house, pooped in the backyard. These people are well aware of it. They let their animals roam. I've also gotten money off of them before for their goats. They had goats that would roam around. And then they tried to blame me because I had my garage door open and they didn't know that the goats were out. These people have 47 acres. They're lawyers. They can't be this stupid, but I guess they are. So my concern is for the animals. I know there's goats in a barn back there. That barn has got to be hot. These barns have never been cleaned out, along with the dog cages. Another neighbor went to look at the dogs one time, and she said you had to step up about a foot or two to get in the cages. The cages are not cleaned out. I don't know how many dogs that there are up there. Supposedly, I've called the SPCA. I've contacted the dog warden. I've contacted rescues. Everyone knows about it, but no one wants to mess with this. So I really don't know what else to say or what else to do or who else to talk to. I'm ready to pull my hair out, what little I have left, but I'm ready to pull my hair out on this. I'm worried about the animals. I'm worried about these goats. I know that they're getting fed, but can you show me on any of these pictures? These people have been here for 7 or 8 years. Can you show me on any of these pictures here one pile of manure where they have cleaned out a dog cage, cleaned out a barn with goats in it? I mean, I'm just saying, dogs, a neighbor had done some work for him. I know I'm going over my time, but I'm going to try to make this quick. A neighbor had done some work for him, and when he was in their basement, the dogs had been down in the basement. There's dog poop all over everywhere, said it was revolting. And I know before, several years ago, I believe she had goats in the house, chickens in the house, ducks in the house, whatever, I don't know. I know that the roof is rotted because they had a tarp on the roof, and the roof is blown off. But I'm basically concerned about the animals. You know, I don't want to see these cats and stuff get killed, but they've got gashes in their heads. You can tell they have ear mites where they scratch, and they've scratched down to where it's bleeding on them. So basically, that's all I want to say. You know, that these are 2 lawyers that you're dealing with. This is unbelievable that we have to deal with this. And I really appreciate the help that you guys have done. I thank you very much, and I hope something else could get done with it. But I don't know what to say about this. This is out of hand. I know she's been up there with a bobcat for the last 2 weeks. I don't know what she's been doing with it, but had a Bobcat up there and had a trailer up there. I haven't seen the trailer go out with anything. So that's basically all I have to say. So thank you very much.
Thank you for your time.
Thank you.
Okay. And, new business, possible sewage.
Before
Yes,
that,
Mhm.
you all are welcome to stay, but this is your option. You can leave too. If you want to stay for the whole
If
meeting,
you
you
want me to
can.
go, I'll go.
You can stay. It might be kind of boring, but if you want to stay, you can, but this is your option to leave. We won't be insulted if you get up and leave.
Thank you, I appreciate it. Thank you for listening.
You're welcome. Okay. New business, possible sewage nuisance.
This property is at 840 Victory Road. We've been having, or there's been issues with the septic system surfacing onto the neighboring property. We received an initial complaint last June, and at that time, the property owner hired a septic company to investigate a possible, they thought maybe there was an issue that they could repair. So they did that, and we continued to check on it to see if that repair actually fixed the problem. A few months after the repair was made, we noted sewage surfacing again. So we worked with the property owner. They got with the soil scientist and had the soil evaluation done in March. But since March, there hasn't been any progress made toward having the septic system designed, installed, or anything like that. Today, I received a call from a realtor who's working with the property owners to list the house for sale. The realtor stated that the septic is scheduled to be pumped monthly until the property sells. And that as part of this listing, she's letting people know that the septic needs to be replaced, and it will be replaced upon the sale of the house with the funds from the sale. But due to the fact that it's been surfacing, we're asking you to declare it a public health nuisance this evening.
Could I have a motion to declare the property at 840 Victory Road, Springfield, Ohio, parcel number 3000600233101-048, a public health nuisance under authority of revised code 3707.01. And further ordering the owners, Michael and Teresa Ratliff, to abate the sewage nuisance within 21 days. And if such orders are neglected or disregarded, directing the health commissioner or his designee to pursue legal action under revised code 3707.02. So moved.
Second.
It's been moved and second. Is there any additional discussion? Hearing none, Ms. Hackathorn, please call the roll.
Dr. Moore,
Yes.
Mr. Adamson,
Yes.
Dr. Robinette,
Yes.
Mr. Griffith,
Yes.
Ms. DeWitt.
Yes.
Okay, motion's carried. Okay, sewage variance, Mr. Witt.
Thank you. All right, this property is located at 413 Bischoff Road. As you guys are probably aware by now, the Ohio Administrative Code requires sewage treatment systems maintain minimum horizontal isolation distances. At this property, we received a call from our building department that they were out at this property for a footer inspection for a new garage. And during their inspection, they believed that during the digging of those footers, they may have hit the leach lines. So we went out and observed that the very end of two of the lines had been disturbed when they were digging the footer. The property owner and his contractor were able to move the garage. So it is 8 foot away from the septic system. The leach field, the ends of the lines, like I said, they just exposed the ends of the lines. So those will be able to be repaired, and the system is not, should not be affected in any negative way. There was no sewage surfacing when we were out there. But due to the building requirements on where things have to be. They were only able to move it enough so it's 8 feet instead of the required 10 feet away from the septic system. There is a drawing and everything in your packet for your reference, but the property owner's requesting approval of their variance to have the garage be less than 10 feet from their septic system.
Okay, could I have a motion to approve or disapprove a household sewage treatment system rules variance at 413 Bischoff Road, New Carlisle, Ohio?
So moved. Second.
Are you approving?
Approving? Okay. It's been moved and seconded to approve. Any additional discussion? Ms. Hackathorn?
Dr. Moore,
Yes.
Dr. Robinette,
Yes.
Mr. Adamson,
Yes.
Ms. DeWitt,
Yes.
Mr. Griffith.
Yes.
Okay. Motion carried to approve. Unpaid sewage.
I appreciate it very, very much.
Okay. Okay.
All right. So, Ohio Household Sewage Treatment Code requires that all household sewage treatment systems have an operation permit and that they be inspected to ensure compliance with code. Some of those systems require a service contract to maintain any mechanical components of the system. So our discharging aerator systems are ones that require service contract. However, in certain cases, all of our systems that are older, pre-2015, the health district is able to do those inspections. And we are able to charge a fee for that service. So in the end of March, all property owners are mailed a letter that have an aerator that the health department is able to inspect, letting them know that they either need to have a service contract and provide us with a copy of that service contract, or they need to pay the health department to come out and do their yearly inspection for them. If they don't respond to that mailing, we send out a second mailing, and then we hand deliver a third mailing in an attempt to get them to either fill out or provide us with their service contract or fill out an application and pay the health department to do that. So we have about 62 properties that never provided us with a current service contract and have not paid us to do that. And actually 2 of them paid the initial inspection fee, but they were late and were allowed to charge a late fee. And so they never paid that late fee. So they're being assessed the late fee portion. So tonight, we're providing you a list of properties that have not responded to any of our letters and ask you to approve a resolution that we can send this letter to the auditor to assess the cost to their property taxes.
Okay.
Can I ask a question?
Yes.
So we send the process again, we send 2 letters, and then you go out and inspect.
Nope, so
Or-
we send 2 letters and then the third letter we actually hand deliver. So we
Okay,
take it
so the
door to
third
door.
letter, and then we still do the inspection.
We still will do the inspection at some point in the year. So some of them, because we have 150 to 200 of them that we go out and inspect, it's sometime between,
It's a significant amount of staff time
yes,
and resource, or I'll
Yeah.
say significant amount of resource.
yes.
How is this fee set? It seems low.
Mike, it's low.
It is low. It seems low. I mean, I
It is.
think it should be doubled,
So this is
maybe triple.
part of a bigger program called the Operation and Maintenance Program, or O&M. You've heard of, maybe you heard us say that. This is actually going to be revamped. We know it's on our radar.
Good.
Including fees. We know it costs more. We know we're losing money on this. And so Zibby and I are working towards this. We're just making our way through everything we need to make sure we catch up to and make sure we're not only doing it right, but we're getting closer to breaking even on some of this stuff. Because this is being subsidized by general fund.
Yeah, that needs to be on.
Yeah.
These owners, not they come, okay,
Yeah.
good. Well, you have my support.
It's not right. It's why they're not writing the right check. It's $56. Okay, the board has before it the full resolution of R 74-24 and a list of properties that are subject to the resolution. Could I have a motion approving the resolution to assess the itemized cost of the property to the owner?
So moved. Second.
Any questions or discussion? Okay, Mr. Hackathorn?
Ms. DeWitt,
Yes.
Mr. Griffith,
Yes.
Dr. Robinette,
Yes.
Mr. Adamson,
Yes.
Dr. Moore.
Yes. Okay, motion's carried. Okay. Position upgrades.
Start with me,
Cook.
because I'm gonna be Emily tonight.
Okay.
So one of the two position upgrades I'll address, and then Cheyenne will talk about the other one. Amanda Cogburn is a WIC clerk, and she has been a WIC clerk 1. She'll be moving to a WIC clerk 2. She's successfully completed a year here and has had good evaluations. And so we support moving her, giving her the increase that she deserves in our policy. That will be effective July 21st for Amanda.
And then the other one is Randy Lynn Belford. She is an LPN with us, but she's been with us for some years, but she was an MA. And then last year she went back to school and got her LPN. So she's been here in that role for a little over a year now, and she's doing great. So we'd like to move her to a 2 as well.
Okay. And so we have motions before you to approve position upgrades for Amanda and for Cogburn and for Randy Lynn Belford.
So moved.
Second?
Is there any additional discussion? Hearing none, Ms. Hackathorn?
Ms. DeWitt,
Yes.
Mr. Adamson,
Yes.
Dr. Robinette,
Yes.
Mr. Griffith,
Yes.
Dr. Moore.
Yes. Okay, motion is carried. Okay. Grant submissions.
Yes, hello.
Hello.
Thank you. You have 3 grant application summaries in your packet. They are all for the Springfield Foundation. So we, as the whole agency, are going to submit 3 applications to the foundation this year. The first one is Start Strong Clark County. So that grant, we're asking for $5,000 to help retain our infant vitality coordinator, Anne Marie. We have received this grant from the Springfield Foundation in the $5,000 amount the past 2 years. So we're cautiously optimistic that we'll be able to be awarded that again. The second one is for diabetes education. So again, we the past 2 years, I believe, have also been awarded this money from the foundation in the amount of $5,000. So we're asking for that again as well. And then the third application was new last year. We applied for it. Unfortunately, we didn't receive any funding, but we're going to try again to help offset some costs for solid waste cleanup through environmental health. So we're asking for $5,000 as well. So for a total of $15,000 to the foundation, 3 different programs.
Okay. Could I have a motion to authorize the Health Commissioner to do all things necessary, including submitting the grant applications, negotiating and executing all related contracts, and creating new funds as necessary for the Springfield Health Foundation grants?
So moved.
Second.
Okay, it's been moved in second. Are there any additional questions? Ms. Hackathorn?
Ms. DeWitt,
Yes.
Mr. Adamson,
Yes.
Dr. Moore,
Yes.
Mr. Griffith,
Yes.
Dr. Robinette.
Yes. Okay. Tobacco and drug-free campus policy. Mr. Cook.
Who was here in 2019? Dayla?
Mhm.
Dr. Moore? I guess that's it. Well, back in December of 2019, the board passed a tobacco-free campus policy. This is what the original policy looked like. it went into effect, that was in December of 19, it went into effect January 1st of 2020, that year. And so we took a look at it, and what inspired us to take a look at that is one day I came in and I said, do we have signs outside of any of our buildings that said this is a tobacco-free, like hospitals do, and a lot of other healthcare facilities, parks, places like that? And the answer was no, except there was one at High Street that was maybe actually still when it was owned by Community. And so I said, well, I want signs, but what about a policy? And so we discovered this policy and said, hey, this is a great time. It's been 6 years. It's time to update it. And so we had Leah Baylor, who's one of our health planners, and Gracie took a look at the policy. And what we have in front of you is a couple of things. First, a revamped policy to use more modern language, to use plain language. But we needed a policy that was definitely more current than what we had. A previous policy got the job done, but it's time to update it. So that's the first piece that you have in front of you. It's 3 pages. I think they did a great job, again, mixing current language with plain language in that new policy. The second piece you have are signs. So they look like this. And so we're going to put signs up at High Street and at Home Road, just declaring that this is a tobacco and drug-free campus, simply saying that tobacco, nicotine, and drug use of any kind is prohibited, including our buildings, our parking areas, basically our whole campus. And so just like your blessing on the policy, I'd be happy to hear any questions that you have about it, and then we're going to get these signs done and up as quick as possible.
Okay. Could I have a motion approving the updated tobacco and drug-free campus policy as submitted at the July 17th, 2025 Park County Combined Health District Board of Health meeting?
So moved.
Okay, I got a second?
Second.
Okay, the signs are gonna be bigger than that, correct?
Yeah, they'll be like, I don't know. We haven't. I sent it to McRae to quote us, and I said, "Hey, tell me what you do with other places." They do these kinds of things all the time, and I said, "Give me the approximate size of what you do for other places." So I don't know. Mike, do you have them at the hospital, right? Do you have any idea how big they are?
Bigger than that.
You probably just look
I
like
think they're like 11 by 7.
Yeah,
Yeah,
like a
something.
something.
Yeah, like
probably
a legal
like
sheet.
This. I think this is. It's 11 by 7.
Okay.
That's probably about the size it would be.
Okay. All right, any additional questions?
I have a question. Just curious, what's the difference between the third and the fourth devices in the circle?
One's a vape, right? One a vape.
Yeah, so they're both big. So we had a question within our core team meeting as well. A lot of time THC or marijuana is smoked through a vape as well. That's especially when you're out in public. That seems to be how people are ingesting it. So yeah, so one a vape and.
So do we, so go
No, I'm
ahead.
sorry. No, I appreciate the fact that it has nicotine listed because I know that the Zyn pouches, they're tobacco free, but they're
Yeah.
and those are very popular right now.
But we don't list, and drug use, you think they're gonna get that to be my marijuana?
Yeah, I have a question on that. Does it matter, do we have to specify illicit drug use or just, I mean, because drugs could be a whole bunch of things.
So
Prescription drugs,
yeah, so in the policy, it does talk, it has definitions
specifies that,
on
okay.
what the drugs are. Give me 1 second. And it says, because marijuana is legal to use, in the state of Ohio recreationally.
Okay.
So any substance that changes or affects the way the body or mind works that is not used legally or as prescribed.
Okay.
This includes illegal drugs, marijuana, prescription drug use without a prescription or not directed, and any substances used to get high. So we try to keep it as general but also specific to include marijuana because it is legal.
And I will tell you, I was the first one that went down that path saying, "Oh, we need more language on here," and suddenly it looked like the policy. And Grace is like, "Chris, we can't have like a book on this." And I'm like, "Yes, I get it. She's right."
Okay, any additional questions? Ms. Hackathorn?
Mr. Adamson,
Yes.
Dr. Robinette,
Yes.
Mr. Griffith,
Yes.
Ms. DeWitt,
Yes.
Dr. Moore.
Yes. Okay, the motion is carried. Staffing changes, Ms. Hackathorn.
Thank you. You can see on the form here tonight, we do have one retirement, Kelly Kitchen, who has worked for us for 10 years. She started in nursing. In the past 9 years has worked in our vital stats division. She will be retiring on July 31st. We do have a couple of new hires you can see. Something I wanted to share is recently our core team decided that we were going to bring all new staff members, once they complete their probation, to the board to introduce them so you can see them, talk to them. So we have one of our newer staff members here tonight who recently completed probation. So I'm going to turn it over to Cheyenne to introduce her.
Yeah, so I'll understand. This is Miss Kim. She is, I think, our newest nursing division employee. She just finished her probation.
Welcome.
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 You want me to, should I say a few things?
Yeah.
Yeah, so I'm Kim Wise. I've been working here since December. I got my master's in public health with concentration in epidemiology from Kent State University. Before this, I worked mostly in schools as a mental health counselor, mostly in Montgomery County. And then when I had my 2 children, I dropped back from full-time and I worked at a family business for a few years. Coached a couple sports at a few local schools, which was kind of fun. But once they got older and were going off to college, I wanted to get back into stuff full time. And I've always had an interest in public health, really all the aspects of it. I like environmental and epidemiology, behavioral. Yeah, so when the job came over with the vaccination clinic, I applied and I'm really enjoying it. Here I'm working in the clinic a few days a week with the nurses. I'm doing some work with one of the grants we have, and then also kind of helping Cheyenne out with the inventory part of it and learning how to do some of that. So I think it's a very good match actually for my skills and interests, and I'm enjoying myself. So
Well,
we're glad for the opportunity.
Glad you're here.
We're glad to have you here.
Yeah, thank you.
Thank you.
All right, thank you.
Okay, could I have a motion appointing new employees to public health services as recommended by the Health Commission, hired from June 20th, 2025 through July 17th, 2025, and accepting the resignations of employees as submitted from June 20th, 2025 through July 17th, 2025.
Second.
Okay, it's been moved in second. Could I ask any questions? Additional discussion? Ms. Hackathorn?
Mr. Griffith,
Yes.
Mr. Adamson,
Yes.
Dr. Robinette,
Yes.
Ms. DeWitt,
Yes.
Dr. Moore.
Yes. Okay. Financial report, expenses and vouchers.
Last month rather, I talked way too long. So
Okay.
in order to avoid confusion, I'm not sure, on my set of documents, the vouchers are about 30 pages long. And if they are on yours, I apologize for that. We tried to consolidate them to cut to the chase. The exciting parts on page 61 and 62 of the vouchers. I'm gonna let the rest of it speak for itself. If you have any questions, I'm happy to talk.
Okay. All right. Everybody review? Could I have a motion approving the payments of the bills from June 1st, 2025 to June 30th, 2025?
So moved.
Second.
It's been moved and second. Are there any questions? Ms. Hackathorn?
Mr. Adamson,
Yes.
Ms. DeWitt,
Yes.
Mr. Griffith,
Yes.
Dr. Moore,
Yes.
Dr. Robinette.
Yes.
Okay. These, there are no transfers or advances.
Correct.
Okay, and we'll take the monthly fund report.
I'm still the new guy. And I've been,
I use that as long as I can.
I'm planning on using it for
Go
another
for
15 to 20 years.
Yeah. I'm
But-
okay with that.
I've been looking at what we affectionately call the sheet of many colors for about 5 weeks now. I haven't seen anything that is tremendously alarming to me. There are definitely some questions in there, and there's some things we're looking at, but I think everything seems to be in order.
Sheet of many colors.
Like that.
All right. Are there any questions? Okay. We're moving to public health team reports. Ms. DeWitt.
Thank you. So the biggest thing in environmental is tomorrow is the start of the Clark County Fair. So favorite day in environmental health. All 7 of our environmental health specialists will be out at the fairgrounds tomorrow inspecting every food facility. There's over 60 of them to make sure that they are in compliance with food code, hopefully, so everyone has a safe, enjoyable treat at the fairgrounds. So that is the big thing. Also, I'm just gonna keep preaching on. It is summer. I know we're not doing our mosquito program, but West Nile is out there. It's been detected multiple times throughout the state already. We do have insect repellent available, again, out at the fairgrounds at our health department booth, so people can go grab some insect wipes to make sure they're protected from the mosquitoes while they're out there at the fair enjoying the fair. We also go enjoy the fair, look in the animal barns, but remember to wash your hands and keep yourselves safe. And also, one last thing, Lyme disease. It is, we do know that the black-legged tick is here in Clark County, and there is Lyme disease here with them. So when you're out enjoying the beautiful weather, make sure you're also protecting yourself from tick bites.
I think I heard that from Ohio State, that we had that here.
Yes.
Be safe. Okay. Any questions? Nursing clinics, second quarter communicable disease report.
All right, so if you look through your packet there, I think my margins are better. I'm not sure, but I think so. I'll let you look through these numbers. If you have any questions, just let me know. But the picture there on the first one, we just had National HIV Testing Day. So 2 of our nurses, Doug and Tara, went to Walgreens and they were offering free HIV and syphilis testing. So that was a good day. And then also not on here with diabetes, Linda and Pat Bray just finished up one of their workshops, and they had all 12 people start and complete 4 out of 6 sessions, which is very difficult to do. So they did really great with that. And then last month, I came to you guys to send 2 of our communicable disease employees to Anaheim, California, to the conference. So they are there this week. I'm a little jealous. They keep sending back pictures.
I saw on Facebook
Yes.
with Mickey and I think it was Mickey and
Pluto.
Pluto, yeah.
But yeah, they're having a great time there.
Nice.
And then with the CD reports, if you have any questions with that, feel free to ask. I probably will not know the answers, but I will take it back to our epidemiologist and I will get some answers for you. But the one thing that stood out to me was just how bad our flu season was this year. I feel like we all kind of felt it or saw it around the community, but it was, if you look at that compared to the last 5 years average, it's pretty rough. And that spike was so late in the season. It really didn't spike until February, so that was kind of interesting. But yeah, that's all I have.
Okay. Any questions for Ms. Sheridan? Okay. Early childhood, Ms. Lambert.
Yes, thank you. I just wanted to highlight a family event that we had. I threw some pictures in the packet for you. We kind of took over the WIC building. We had a lot of activities in the conference room, and then we were out front a little bit. Just a lot of activities for young families with little babies and toddlers. And the Young Women's Mission helped us fund that. They gave us a few $100s, so we used a couple hundred for that. We had some door prizes. We had some food. I always want more families to come that do. We had 20-some families come and about 58 people. So it was fun. It was enough to have fun, but always want to have a few more. And I think my favorite picture, I had to point it out, is this little baby in the middle on the second page. She's holding the Help Me Grow rattle exactly at cue for a picture. I thought that was really perfect. So I said, put that one in the middle. It's my favorite. Anyway, we were also invited last month to Kiwanis to pick up some tummy time blankets because we are continuing that collaboration that started Kiwanis has helped us for a long time, but then starting last year, one of the 4-H clubs said that they wanted to participate. So Kiwanis buys the materials. I wrote it down so I wouldn't forget. Hundreds of Hooves 4-H club. They put the blankets together and they deliver them to us. And then we take them out to the families in the community. So it's a pretty good collaboration. So that happened in June as well.
Very nice.
If I can just add one thing, had we put in the picture of the Lori hula hooping, that would have been your favorite picture.
Sure. That's not very nice. I'm glad that you didn't.
You can save that for blackmail.
Retirement.
Yes, retirement, that's a good time. And women, infant, and children, Mr. Cook.
I'm going to fill in for Emily. So you've got the report there. Just a couple of things that stood out to me as I looked at her report. Down at the bottom right, you'll see the WIC SRMC, Springfield Regional Medical Center visits. Again, I just want to highlight this partnership where we have one of our certifying health professionals going into the hospital, into the birthing center, and doing bedside certifications. It's a great thing. I love that we're doing this now. And you can see the numbers. We're being very consistent with both new certifications and recertifications in the hospital. It's a great partnership. Just applaud our friends at Mercy and Springfield Regional for allowing us to do that. Elise Brown has been very instrumental in that. So high five her for me, Mike. She's fantastic. Really enjoy working with her. The other thing that kind of stood out to me is also if you look at our numbers for May and June for the number of caseload that you see listed at the bottom, again, you're looking like right here. You see those numbers have risen as compared to the previous months. If you do some quick math, we have not been operating in New Carlisle. If you do some quick math, the amount of folks that we were seeing in New Carlisle is the increase basically that you're seeing in Springfield. So we know that some of the folks that were going to New Carlisle Clinic, it's not super convenient for them to come into Springfield. So they found a couple other clinics like in Greene County, but we've actually incentivized New Carlisle patients to come to Springfield with diapers. Say, hey, if you come for your first couple visits, we know you're leaving New Carlisle and come to Springfield, we'll give you some diapers as an incentive. You'll love our facility. And so I think that's going well while we have not been operating in New Carlisle. So I just wanted to say, the people are still being served one way or another. And the numbers even reflect that. The other thing too is Emily said that the farmers market vouchers, even though they're less than last year, they're coming. We hope to have them the next week, and we're going to get those out to people so they can take advantage of our great farmers markets and get some fresh fruit and produce. So.
Very nice. Hope that program continues. Okay, any questions? Health planning.
Thank you. So you have the packet in front of you if you have any questions. I will just follow up, Zibby. I've done this in a couple of meetings, but our great environmental health staff is making sure that all the food is safe out there. But the health planning team mans our booth, the health department booth inside the Mercantile building all week. So if you are out at the fair and wander into the Mercantile building, it is air conditioned now, and you can go visit the health planning team and visit the health department booth. And then we also we man and coordinate the breastfeeding booth that is also in the Mercantile building. So just a couple of highlights from a couple of programs. Tobacco, a couple of updates there. Last month in June, our program worked with the Clark County Sheriff's Office to do compliance checks of tobacco retailers. A little bit of a mini stroke. Retailers outside the city limits. So as you know that we have a tobacco retailer license within Springfield, and we'll be doing compliance checks with those soon. So we also have to check the ones that are outside the city limits. So a total of 32 stores were checked, and 3 stores were found to sell to the underage purchaser. So we want a 0, but 3 is not horrible. So those retailers will get education and to remind them kindly with some letter and some education about the TU 21 or T21 law that can't sell to underage individuals. Also with tobacco, there was some delay because of the state budgets and really the federal budget about getting our notice of award for the new grant year for tobacco. So it was set to start July 1st and run to June of next year. It was a competitive year, so anyone was open to apply, and there was a delay because they were not going to get any federal funds, so all of the funding was going to come through the state general revenue fund. We were fortunate to be awarded. We were not awarded fully, so we applied for I think $130,000, and we got awarded just over $122,000. So it's about $8,000. It will impact very minimal of the program, but the state overall cut the number of awards pretty much in half of counties that got it. So we are very fortunate not only to get the award, but also to get as close to fully funded as counties could get. So that program is now starting. We never stopped, but it is nice to have that, notice of award in hand to make sure that we can still pay folks. And then the last thing I just want to mention is I mentioned it last month that we started the bike share program, officially kicked off in the partnership with the library. There's some pictures there through our Creating Healthy Communities, and Ashley, the health planner that coordinates that grant, has been fantastic on getting this program up off the ground. So far, we talked to the library. I think Ashley talked to them earlier this week. 30 people have checked out bikes it's been less than a month. Mm-hmm. So we're pretty excited about that. And everything is getting returned. And that was a concern that some people brought to us as we were getting the program started, but everything is going smoothly and the library is very happy. We're excited that it's being utilized, and we're excited to see where it goes.
Are those electric bikes?
No, they're not electric bikes.
Oh.
Yeah. But
Exercise.
active living.
Pedal power.
Okay.
But the wheels are wider like an electric bike.
That's right. Mm-hmm. Okay. Nice.
Very good.
Any questions?
Do they wear helmets?
Yes. So yep. You can get helmets, and you can actually rent a basket for the front too.
Yeah. Wow.
Check out a basket.
Cool.
Yeah. And you get a bike lock when you check out the bike, so that if you're going somewhere and you need to lock it up.
That's nice.
Yeah.
Mm-hmm. Legislative updates. Mr. Cook.
Before I get to legislative updates, because there's really no other spot on the agenda for this, I just want to highlight the next couple pages in your packet are revamped reports that are courtesy of Shannon. So they look like this. This is your vital statistics report, both a death and birth summary report. Shannon did a great job trying to provide you with even more useful information. It's one thing to just put numbers and on a page with years, but it's another thing to actually put it into not only digestible format, but something you can carry forward and look at yourself and have good conversations in our community about our birth rates and what's causing people to die in Clark County. So this is the first month of this. It might take you a month to digest this and see what the trends are, but we put the comparison of 2024 to 2025 for the quarter 2 on the death summary report. So I think this is a great tool going forward. So thanks, Shannon. This is great. Another tool we can use to assess the health of our community. Also, not legislative related, but I wanted to mention, I don't know if you've seen this week out in the community, some new vehicles that are wrapped called field trips. Has anyone seen one of these? They're okay.
Yeah.
So you'll see these. I wish I didn't bring a picture to show you, but field trips by Via Transportation is the new solution for transportation needs in Springfield. It replaces the SCAT bus system. If you haven't had a chance yet to check out, there's a website. If you just Google search for field trips in Springfield, it'll take you to a website that talks about how they operate. I saw a presentation this week by Jason By, the city of Springfield, and that group that they've hired and contracted to do this. It's a really interesting formula. It basically uses microtransit. It's very Uber-like. And so there's a 2-week overlap where the buses are still rolling right now, but starting on July 29th, they will not be. You will just see those field trip vehicles. And so I'm not part of my whole speech tonight here, but you should check it out, learn more about it. It's a very interesting concept. And for 2 weeks, by the way, it's free. So every trip if you want to try it out yourself and you're traveling in the city of Springfield, you can do it for free for 2 weeks. After that, for most people, a trip will cost you between $2 and $4. And so I think it's affordable and just an interesting concept of kind of micro transit is what they're calling it.
So Chris,
So I haven't got
Oh,
past
now
moving
wait
on
a
the bus.
second. I don't know if I can answer your question.
yeah, you can. I believe they all are handicap accessible and they can take wheelchair transport.
So yeah, there are 2 types of vehicles. Ones that not all of them.
Okay.
I think there's 16 in the county, 13 are rolling at any point in time. I believe it's 6 or 7 that are wheelchair accessible. They're ADA accessible.
So we don't have public transportation anymore.
That is the
That
public
is.
transportation.
That's
And
it.
it runs from what to what?
It's right now they're starting Monday through Friday from like 6:45,
6:40 to
6:40 to 6:40.
That's what the current.
That's what the current system
Yeah.
is.
I know, and it wasn't enough.
But they are
So I'm
talking
like-
about, as they see, the cost and things like that. I know it's on their radar to expand, absolutely. Later hours and evening and weekend. So I don't know what their timetable is for analyzing the use of the system, but
I was on a committee as they were studying this, and I mean, it's really novel, and they patterned this after a town in North Carolina, I think.
I don't remember what state. Yeah.
And where they put this into play, and it has replaced the bus system, and it's much more cost effective. And the first phase is they're equaling the hours that buses are running now, which is not enough. But the goal is to provide, extended hours. In the restaurant business, how about closing shift? I'd like to have people that you get a ride home from work too.
Yeah.
So this could be utilized by employers. You could, I downloaded the app. I mean, it looks pretty easy to use. But I did not hear that it was free for the next 2 weeks, so I'm guessing I'm gonna get a ride. I'm gonna try to find a place to go.
It would be nice to just experience it, just so you know what folks are utilizing. So
Yes.
So anyways, any other questions about that? Can't guarantee you can answer, but okay. All right, so let's get to legislative updates. Obviously, there's been a few in the last month. Let's start at the federal level. The budget reconciliation bill passed, and so that did a few things. If you look at AOHC, Association of Ohio Health Commissioners analysis, obviously the things that you've heard about in the news are reflected in AOHC's analysis. Permanently extending tax cuts, increasing funds for border security, defense, energy development, but I will say at the expense of a few other things. Those things include our healthcare and nutrition programs, Medicaid, SNAP benefits, that supplemental nutrition assistance program. The CBO, Congressional Budget Office, has estimated that this is going to, over the next decade, is going to increase our federal deficit by $3.4 trillion while we're going to watch millions of people lose their health care coverage. It's very sobering if you look at the real statistics behind Medicaid, the things that are happening there, and the new work requirements of what are called able-bodied adults. But it's projected over the next 10 years, over 12 million people are going to lose their insurance. And so I think some of the fallouts we're going to see, everybody's going to end up paying for that. Just because people lose their insurance don't mean they stop needing care and getting sick, they're still going to get that care. I feel bad for you, Mike, because I think they're going to come and tax the hospital system very much so. Yeah, so we're all going to end up paying for it. Absolutely. If you don't think that's the case, you're mistaken. And changes to the SNAP program is significant. A lot of food literally being taken off the plates of people in America. For us here, besides those things, what does it mean for us here? You already know that we lost $2.7 million with the DOGE cuts to HHS funding. That happened back in March for us, that resulted in staff layoffs. Our emergency preparedness funding, which is a federal grant, we just found out the last couple of weeks was cut by 25%, but there's a very real possibility that that money is actually going to be returned through some of the things in that budget reconciliation bill at the federal level that actually has reorganization of some of these areas. And so in several conference calls with the Ohio Department of Health, we have pretty good confidence by the time we get to fall and winter, that other 25% is going to actually end up coming to us. So we're very hopeful about that one. Gracie had mentioned about the tobacco use prevention and cessation program being cut by about $8,000, but I think we agree. We feel very fortunate that we were funded because so many were not. So we did very well in our application and just very thankful that that was funded even with the $8,000 decrease. The other thing that Gracie mentioned last month was the Lead Safe Home Fund in the state budget that was cut over the 2-year period by about $300,000 for us. So unfortunately, we're not going to be able to do as much lead poisoning prevention education and workforce development over the next couple years here. Other things locally, Governor DeWine also signed House Bill 96, the budget bill, with 67 line item vetoes. Among those line item vetoes, it includes some things that we were on AOHC's side of things, we were very, very much watching. A couple of environmental health things when it has to do with soil evaluators, a depth credit relative to shallow water areas. So a couple of things that were wins in the vetoes for environmental health here in public health. A few other things it looks like are going to be challenged. So we believe actually there's a vote being called for. Of course, the state legislature is on recess right now, but they're trying to get people back for a vote on the 21st of this month. That's next week, to do some overrides of several vetoes, really focusing on the property tax issues. So in the property tax arena, they were targeting up to 3 of his vetoes. 2 I'll bring to your attention. One of them was he vetoed, you've heard me talk about it several times, eliminating our ability and other municipalities' ability to have replacement levies and not just renewal levies, but he vetoed that. It looks like they're going to go after that and still make that off the table for us. So if they override that veto, independent subdivisions of the state, including us, we won't be able to have replacement levies. The other thing is the property tax reform group that he is forming to take a look at this. It could be a target of an override for the vetoes as well. So you've heard, it was tried to put on the ballot for next fall, but they didn't get enough signatures to basically eliminate property taxes in the state of Ohio. So there's still some risk there for an override of the vetoes in those areas. So a lot of things that have affected public health that will have ripple effects on really local governments as a whole coming up here in the next 2 years, which is what the budget bill is. One other thing I'll note in the budget bill, there was a burial permit fee increase. It right now for our funeral homes, and it costs $3 to get a burial permit. It's going to $10. That's 90 days after the effective date of when it was signed, so that's coming up here another couple months. It's still unclear. We get a little bit from that $3.
I did confirm we get no more.
Okay, so how much are we getting, Shannon?
50 cents.
We get 50 cents of the $10, by the way. Wow. We charge it, we collect it, but we're transmitting now $9.50 to the state, and we keep 50 cents for doing all the work to issue a burial permit. Did you know, by the way, since we're in this realm of certificates, we don't keep the whole $24 that we collect for issuing a birth certificate? How much do we collect, Shannon? Do you know off the top of your head?
The state takes $13.50.
Yeah. So we get less than half of that and do all the work for it.
You get more for birth than death.
We get
More people are dying than they're born, unfortunately.
So.
Well, that's gonna increase because all these people don't have healthcare now.
The last thing I'll mention too, so in the realm of federal cuts, I will say thank you to Gracie because just about an hour or so, two ago, she sent this link to me. It was just announced that Planned Parenthood has announced the closure of a couple of clinics in Ohio. One of them in Springfield, the other one's in Hamilton County. And so it'll be interesting to see the demand on our reproductive health and wellness services with the closure of those two clinics that were announced just a few hours ago. So I'll be watching that very carefully, how that's going to impact our services and the demand for them. So. That's all.
Executive session? No? Any additional business? No. So the next meeting date is for August 21st, 2025 at 6 p.m., same place. We're not moving. All right, and so I'll call for adjournment. Could I have a motion to adjourn?
So moved.
Second.
Okay, anybody object to that? All right, all in favor? All opposed? All right, the meeting is adjourned. This was so much fun.